Pleasure to be here. Thank you for inviting me. So I'm going to make some remarks, and so just one caveat to my remarks. I'm pretty unsubtle in terms of what I say, so it's pretty direct. And I have some strong beliefs on this, and some are very consistent with what we heard this morning, and some may not be. But I come to you not as a public policy expert. What I do come to you as is in a dual role. One is a chairman and CEO of a biopharmaceutical company, a company that I've essentially worked in my whole life, the whole adult life, and focused on discovering, developing, and commercializing drugs, largely for rare and orphan diseases. So this is a very important area to me professionally. I also come to you as a father of 4 and a grandfather of up to 10 now, and grows every day, and 10, and with children and grandchildren that have rare diseases. So I have a dual role, and my personal passion is finding drugs for serious, debilitating illnesses, and we focus on orphan and rare diseases. So please recognize that. So what do we need to do? So I think in terms of orphan drug exclusivity, in one way or another, try to incentivize additional research on compounds that have activity in certain orphan diseases. And we can extend, there's a number of ways in which we can do that, and it's not a huge thing, but I think it's very, very important because I happen to be a believer, despite chairing a, $18, $20 billion company, I'm a scientist at heart and truly believe, against much evidence, that at the end of the day, science solves many, many problems. And if you look at 6,000 orphan diseases, many of those diseases you can probably lump together in terms of mechanism of action of the disease, the pathology of the disease, the science behind the disease. So as you start solving some of those problems, it's going to have implications in other related diseases. At the end of the day, it's important for us to take action now. And just let me summarize by saying that there is, in my heart, I believe very strongly that we've made significant progress in science. We heard some great things this morning about the interaction of academia and government agencies and private industry. And I think if we do that, we will indeed find treatments for many, many more diseases than people currently anticipate.
And we as a communities, we have to learn to talk about this in a way which shapes the debate in a way that it doesn't get distracted or hijacked by people who have their own agendas. So as you can see, the major thing for biopharmaceutical industry is tell me we have a market. If we have a market, we can figure the rest out. We'll be willing to invest enormous amounts of money to get to the goal. The healthcare system, they want innovative solutions. I mean, they are, having a disease cured can't be a problem for the healthcare system. Academia, as I said, they follow the money, research funding, and again, preserving the ability to have that in place. And economies, at the end of the day, high-tech jobs out of the healthcare industry is not a bad thing.
1982, orphan drugs represented 0 proportion of all drugs that FDA approves, all FDA approvals. In 2009, it represents somewhere between 30 and 40%. It's been growing pretty rapidly, and we really are the future. This rare disease community and this increasing personalization of medicine is the future of the agency. It's where we're going.
I really like this idea of strength in numbers, of a comprehensive overview set of strategies built around the science, built around the advocacy, built around the public outreach. And not think of this as a series of tiny fragmented diseases, but think of this as a community and advocate as such.
It really is a concern. It really is a concern to me that somebody who wants to be productive in society and work as I do would be forced to leave employment, to paper divorce his wife, live in an apartment somewhere legally so her income and my income wasn't included in, go apply for Medicaid, apply through Social Security for disability, and then have the government take care of me to the time that I die. And what really concerns me is how this is going to play out in the future with comparative effectiveness. And lifetime caps should be eliminated for people with chronic conditions, especially rare conditions, because without insurance, I couldn't afford to pay for my medication, therefore I would die. So thank you.
Peter, thank you for the opportunity for the day. I turn it back to you.
David, let me say, I would like to thank everybody in the room for participating, and especially everyone sitting at this table, and including the people that were here this morning, for the absolutely stimulating and insightful conversations, thoughts, and ideas that came out of today. When we started the morning, I said we were trying to help set the policy for NORD moving forward, and I must say it's a fairly potentially long list here, although I think we're well positioned to help lead some and be a very active player as healthcare reform begins. As we've been at the table now, but we now have some clearer ideas of where we may want to go. I will tell you that we will publish the results of this this one-day summit on our website. All of the slides will be on there in about a week, as a matter of fact. And we are looking to produce some documents with the help of Frank and a number of other players that are sitting around this table. And I hope that will help me set my direction a little bit. I have some key ideas, but as we were going along today, I have about 400 additional ones now. So we really need to try to focus that down and understand the impacts that affect our audiences and where we can have the most bang for our buck, if you will. So more will follow. Keep track on our website, if you will. But again, thank you to everyone for giving us their time and their energy and their thoughts today to make this a very successful day. So again, thank you and an applause for everybody.